on the occasion of release of book Advancing Frontier, Part 2 of Principle and Practice of Homeopathy, authored by Dr. Kumar Dhawale sir and inspired by late Dr. M.L. Dhawale sir. All the legends who are the part of family of this Guru Kul Parampara. I think everybody sitting on the dais and sitting off the dais are having a inbuilt capacity which was developed by Kul Guru MLD sir, and they have also spreaded that Guru Parampara and become teachers of the teachers. With respect, I shall take name of Honorable Dr. Kumar Dhawale sir, Dr. Kishore Mehta sir, Dr. Praful Barwalia sir. I think everybody deserved to be named from this stage. So everybody has their own aura and developed the legacy of MLD sir and spreading the education of homeopathy to not in this Maharashtra or Bombay, but spreading to Gujarat and every state of India and maybe outside the India. Actually, I shall, in person, I am feeling proud. I feel I am honored to be invited here for such a occasion of the release of book. Sir, Mehta sir is told that he was number 27th in 81. I have completed my graduation in 85. I was also number 27, sir. I came to institute at Parekh Street. I have tried to perceive. I spent few days here in the institute, but because of some ill health, which was because of the weather of Bombay, I could not continue. Otherwise, by hook or crook, Kishore Mehta sir has continued, and I have left. Then I went to Dr. R.K. Desai sir. He taught me homeopathy, prescribing. And I think the training of homeopathy through this institute, ICR, they are producing, I think, humanity, man, everything, every kind of a good practitioner with ethics and a man of society, creating a human from a homeopath. So they are creating excellent homeopath with human being. Similarly, I was inspired in 1986. I have also joined some institution which has such power of creating human being and rather nationalism. So my way was diverted to some extent. I became a teacher. And from 1987, I worked in different institutions, and actually when I have been given a charge of chairman, I don't say that I should have the knowledge of homeopathy like you all people have, or knowledge of implementing homeopathy, because we have took help of every homeopath, especially during the tenure of working with the CCH and even in NCH. NCH is grace to have all expert, and I think more than 25 to 30% expert were from this school. Dr. Dhawale sir very actively participated in a core committee for creation of this curriculum. Dr. Bipin Jain sir, Dr. Anup Nigiyokar ji, and many more. So we are not technically sufficient enough without the help of every fraction of expertise homeopathic professionals. And actually I was briefed many information, and I have collected about MLD sir. I wanted to speak it, but I think it was a formal speech. So when I am representing National Commission for Homeopathy, something formal is also needed, but many things came from my heart, sir. I always respect this legacy of Dr. Dhawale sir, and also I am a clinician, but the patients where I am not succeeding, or where I find that I am not sufficient enough to treat that patient, I am referring to Dr. Praful Barwalia sir, Dr. Manoj sir, and to the Institute of Dr. that Karjan College Hospital. So most of the time I am taking help of the people who actually worked in this institution, and really they are trained and they are practicing much more better than many more experienced practitioners. So still I am continuing my practice, being Monday to Friday in Delhi and Saturday, Sunday in Gujarat. But I shall say that this book will definitely going to be of much use for understanding of homeopathy philosophy in a most better way. Kul Guru to Gurukul, that is the actual happening thing which I have seen today here. That Kul Guru MLD sir have produced, I can say is a Rushi Tulya for homeopathy fraternity, and especially for our country. So many homeopaths came to him, to this Kul Guru, and gradually these institutions becomes a Gurukul. So there are many more faculties developed through the inspiration of MLD sir. And the principle and practice of homeopathy part 1, which I have studied, part 2, advancing frontier, many things I have heard today and I knew today. I think whatever this book is containing shall be useful to every students of homeopathy at the postgraduate level. That is, that level I find appropriate for this book. And furthermore, the two institutions which are also with the backbone support of this ICR, undergraduate and postgraduate institutions are operated, run by this support of this institute, ICR, and both have credibility in the producing a good homeopath in India. So I can take few examples. I know Dr. Saunil, a very good practitioner in Rajkot. Earlier Gujarat was having little less homeopathy practitioners. The homeopaths are coming for homeopathic education to practice allopathy, not to practice homeopathy. But now the trend is changing in this western part of the country, Maharashtra, Gujarat. I think the ratio from 10% is rising to 30-40% for practicing of homeopathy. I am experiencing much of difficulties while looking from top to our community. There are many challenges for homeopaths in coming days. As homeopathy is accepted more and more by the society, the challenges are also increasing more and more. We are receiving many grievances against the system of medicine, against the practitioner of homeopathy, against the good practitioner of homeopathy or good practice of homeopathy. And also from those who are nurturing homeopathy, all the institutions. So we have NCH this time has tried to establish such a standard that can be compared with Indian system of medicine and modern system of medicine. And according to new education policy, while the country is looking toward the integration of all system of medicine, the responsibility of homeopathic institution in the way of teaching is also needs to be streamlined. So the standard which were established in the curriculum are according to new education policy, and I see many of the reflection while discussing with Dr. Hitesh, while discussing with Dr. Bipin Jain, that many of the things which is explained under the new education policy are similar to the thoughts of MLD sir. And I have pointed out certain things also, that what this legacy has thought for the education. And this, both the books has a concept, few of the points which can be compared with the points of new education policy and this our new curriculum, are philosophy of integration and case-based teaching that has been implemented since 2 years by National Commission for Homeopathy. Student-centric approach for the study and participative learning. There is an integration of teaching of materia medica, organon repertory with the pathology, materia medica, organon repertory with the physiology, with the anatomy. So, all the integration and participation learning is there, it is included, which was an essence of thoughts of late Sri MLD sir, which I perceived during the discussion. And another points, holistic and multidisciplinary quality education, conceptual understanding rather rote memorization, skill development. Palghar institution was inspected for the primary permission of post-graduation. I came there and I have seen at that time peripheral dispensaries and everything when I was in CCH, and started post-graduation course at that time. So students, PG students are sent to community for the medical services that produces selflessness, and with the integration of modern and homeopathic science together. So application of skill, development of skill, workplace based learning on patient, on the workplace, in the OPD, there should be maximum learning. So the number of patients required in homeopathic colleges are increased. The arguments are there from the stakeholders that this false case preparation will be increased like that. But I was happy to know that Palghar College has 300 plus OPD, which has crossed the mark of requirement. Another point which can be compared with the thoughts of MLD sir, creativity and critical thinking, flexibility in curriculum and assessment, technology integration. Today I was hearing on the panel discussion, Dr. Kapse sir put stress over the technology involvement, and also the use of AI. The legend of software is also here in Bombay, Dr. Jawahar Shah. So these all the things are incorporated in education also. So technology integration, research innovation, teachers education. There is continuous process of educating the teachers about the technology, about the CBDC, and about the new education policies are going on. There is one thought which actually in the commission we are going to put something that a continuous process of training for the teachers related to our new curriculum may be taken over, some permanent center may be established. And one more thing, we also have opened the probability to introduce such publications to be a part of curriculum as a textbook or as a national book. As a reference book, as a textbook for UG and PG students. And in last meeting only, I was not knowing that I am going to come here, sir. But fortunately, in last meeting, we decided a policy for that also. And we have declared, Dr. Hitesh was there in the meeting, and we have decided the policy how we can induct such kind of publications into academic use. So I think I am very small to speak about this legend, sir, but I am honored. Thank you very much for calling me here and hearing me peacefully. Thank you.